Hello, my name is Laurel Kittrell, and I am a second-year resident at Mountain View Regional Medical Center in Las Cruces, New Mexico. This poster presentation is entitled Vaping, A Moment on the Tongue Can Be Tough on the Lung. The key point is the importance of obtaining a thorough history with emphasis on the consideration of e-cigarette or vaping-associated lung injury, or EVALI, as a possible cause of hypoxia in an otherwise healthy adult. This case presentation begins with a 22-year-old male who presented to our hospital with fevers, shortness of breath, cough, and congestion for 4 days prior to admission. He also reported a 1-day history of diarrhea, nausea, and vomiting. He had been tested for coronavirus disease 2019, also known as COVID-19, as an outpatient the day before presentation, but the results were still pending at the time of admission. He admitted to vaping, stating that he had mainly used tetrahydrocannabinol, also known as THC, and flavored vaping products, but generally avoided tobacco products in his e-cigarette device. He vaped for approximately 2 hours each day. Chest radiographs showed multifocal pneumonia of bilateral lower lobes, and chest computed tomography, or CT, showed diffuse bilateral airspace disease. The patient was admitted for COVID-19 rule-out, but he had had 2 negative tests during the hospitalization. He became hypoxic, requiring 4 liters of supplemental oxygen via nasal cannula. He continued to have tachycardia and intermittent fevers. Pulmonology was consulted, and a bronchoscopy was performed. Pathology showed benign appearing bronchoalveolar cellular constituents in a background of acute and chronic inflammatory cells. Patient was presumed to have EVALI and was started on high-dose oral prednisone. His fevers and tachycardia subsided, and he no longer required supplemental oxygen. He was discharged on hospital day 8 and was prescribed oral prednisone with a prolonged 6-week taper at the time of discharge. When he presented for a follow-up visit in pulmonology clinic 6 weeks later, follow-up chest CT was normal, with complete resolution of radiologic findings. The patient was educated extensively, both during his hospital stay and as an outpatient in pulmonary clinic, on the importance of abstinence from vaping products. Vaping has achieved widespread use, particularly among teens and young adults. The recreational and non-prescription use of THC for mood and pain is becoming more common as well. Our patient was honest about his use of vaping products, which helped lead to a correct diagnosis. It is useful for clinicians to ask about vaping and to further ask more specific questions, including types of products and devices used and the frequency of use. EVALI should be considered in patients with a history of vaping, particularly when using THC or other flavored vaping products, which often contain vitamin E acetate, which has been identified as a likely causal agent in the development of EVALI. EVALI more frequently affects males than females and is often associated with gastrointestinal complaints such as abdominal pain, nausea, vomiting, and diarrhea. The diagnosis can be particularly challenging during the current novel coronavirus pandemic because pneumonia-like symptoms and gastrointestinal complaints are common in both disease processes. Radiographic imaging typically shows diffuse hazy or consolidated bilateral opacities. The hallmark pathological finding on bronchoalveolar lavage or autopsy are foamy, lipid-laden macrophages, but other findings are commonly present and consistent with acute lung injury. EVALI should be considered in a patient with a history of vaping use, a pneumonia-like syndrome, particularly when no other causative source is found, as EVALI is often a diagnosis of exclusion. Treatment is generally supportive, and the use of oral corticosteroids in the treatment of EVALI has not been extensively studied. Patients are at high risk for respiratory collapse requiring oxygen supplementation or, in some cases, intubation and mechanical ventilation. The Center for Disease Control, or CDC, has specific guidelines and resources for the monitoring of patients with suspected EVALI, including a discharge readiness checklist and management algorithms to determine whether patients can be managed as an outpatient or require inpatient monitoring. Thank you for your time and allowing me to participate in this case presentation. I wish you well.